Good morning, all. I'm Dr. Mahesh Anantha. I'm one of the fellows at the University of Minnesota, and we are here at ACC 2019 with Dr. Kenneth Rosenfield, the section head of Vascular and Interventional Cardiology at Harvard, and also a past president of SCAI, and he's an interventional cardiologist here with us to talk more about advice for fellows going into interventional cardiology. How are you doing, Dr. Rosenfield?
Very well, thank you.
Yeah.
Thanks for meeting with me.
Oh yeah, thank you for getting the time with us. So what do you advise for fellows who are planning to do intervention and endovascular intervention in the future? What's your early career advice for people?
Well, it's a great question. I think obviously those who are interested in intervention should really focus on attending the sessions that are directed towards intervention, number one, and make yourself known, get involved. Express interest and try to find a mentor that is going to champion your cause. Also, obviously, if you're interested in a particular research area or a particular aspect of interventional cardiology, whether it be structural or high-risk PCI or vascular or any other interesting, molecular issues, that kind of thing, gene therapy, then explore your interests. Basically, keep an open mind. Try to attend all the different types of sessions and find out where what might intrigue you the most, and then pursue it. Don't be shy about approaching the people who are the maestros, the gurus of that particular area. So, for example, I have an interest in pulmonary embolism, and helped create the Pert Consortium, this team-based approach to PE. So, if you have an interest in pulmonary embolism, find me, track me down, and the others who are leaders in this field, and ask how you can help, how you can contribute, what projects you might get involved in. Roll up your sleeves.
Oh, no, for sure, yeah. That's a wonderful thing you've done, like the Pert team, what we never used to do in the past. We're just taking care of these patients and trying to help them better, and that's wonderful. Like following you, there are a lot of places that have started the Pert team as well. What do you advise to any program that's trying to establish a Pert team?
Well, we have I guess what we call a initiation type program. The Pert Consortium is something that started about 5 or 6 years ago, and it's really grown like crazy. It is an opportunity, by the way, for young fellows. In fact, the Pert Consortium is really made up more of young people who see the value of team-based approach to management of complex patients. So that's been kind of fun. And what I would say is, if you have any interest in PE and you want to set up a team-based approach at your institution, again, give us a call, or look us up online at pertconsortium.org. And try to explore opportunities there. We do have a program to help institutions who are interested in starting these things. How do you work with your administration? How do you work with your colleagues? How do you set up the mechanisms of activation so that you can all be involved in these rapid decisions about how to manage a patient? It's been a very rewarding experience, mostly because of the fun aspects of working together as a team to improve outcomes for patients. The other thing I would say is that that area, specifically Pert, so you mentioned, since you're asking about PE and Pert, and putting that together with your earlier question about what opportunities are there and what should you pursue, well, that's one area where it's very fertile for research and data development. We are really behind in terms of accruing a database and figuring out how to best manage this entity. So working together as a team, it's a great opportunity for young cardiologists and others working with your colleagues in other fields to try to answer some of these questions.
That's wonderful. Is there anything fun that you did in New Orleans apart from ACC 2019?
Oh, had a great dinner last night with David Cox and some other friends down here. It's really fun to network. I mean, that's the other thing I would say to any young interventionalist or person interested in intervention is, find your colleagues to network with. That's half of the fun of being an interventional cardiologist. It's the great people in our specialty.
Again, thank you so much for joining us today at ACC.
Thank you for interviewing me, Mahesh.